I am Dr. Dayakar Rao. I am a surgical oncologist. Today we are going to discuss one of the most important topic, which is chronic low-grade inflammation. This is one of the main reasons for most number of hospital admissions, directly or indirectly. So what are the most common reasons for hospital visits and hospital admissions? Number one is hypertension, diabetes, which related to also chronic arterial disease, CAD, and coronary artery disease, and also cerebrovascular accidents. This is the number one. Number two is also cancer related disorders. Number three is chronic neurodegenerative disorders like Parkinson's disease and also Alzheimer's disease. Four is joint related disorders as well as the rheumatoid arthritis. So these are the four reasons most number of hospital admissions and hospital visits happen. What is the most common reason? One of the most common reason for all these disorders is chronic low-grade inflammation. This chronic low-grade inflammation usually mediated by interleukin 6 and also interferon gamma. What motivates them to release these kind of inflammatory mediators are truncal obesity and insulin spike. Third one is leaky gut. All these three are directly or indirectly related to processed food and lack of fiber in the diet. So truncal obesity, which we usually see in Indian subcontinent most commonly, leads to release of these inflammatory cytokines, which are interleukin 6 and also interferon gamma. And the leaky gut, when you eat processed food, usually there is a tight junctions in the gut which are mainly dependent on the fiber gets destroyed. That leads to LPS, lipopolysaccharide, goes into the bloodstream, that leads to chronic inflammation. And also usual this regular insulin spikes because of the properly processed food also causes this kind of a inflammatory mediation. These three things which leads to chronic inflammation further leads to many of the visits and the hospital admissions. So how can we prevent that? There is a famous book by Robert Lustig. You can also go through that book. It's a metabolical. What he suggests is a pediatric neuroendocrinologist. What he suggests is mainly protect the liver and support the gut. How do you protect the liver? To avoid processed food. And how do you support the gut? To regularly eat adequate fiber, which is soluble and insoluble. So these are all a slow process. If you do it for over a period of time, usually your health will be improved. Thank you.
If you found this video useful, like, comment, and subscribe for more health updates.